welcome back to Rinsang vlog. So this is another educational vlog where I'll be talking about OSCE, obstructive structured clinical examination, for the nurses who would like to pursue their career here in the UK. So this is going to be your final and the last examination which you will be writing after coming here. This is mainly a practical examination where you will be assessed how you will be performing in the clinical areas and everything. So yes, so in this video I'll be talking a little bit more in detail about how this exam pattern looks like and what all are the skills which you will be expecting on the day of exam, what all are the cases scenarios which you can expect, and some of my own experiences, and sharing some of the tips and common mistake which we normally make and how that can be avoided. So yes, hopefully that this video is going to be helpful for some of you guys, those who will be writing this exam of OSCE sooner or later after coming here in the UK. So yes, so without wasting much time, let's begin today's video. So basically talking about the OSCE exam pattern, so usually we have like a 6 station. So mainly 4 is for the nursing process, assessment, planning, implementation, evaluation. For your skills, it will be skills station. So there are several skills, so which you will be getting 2 skills out of it. But from August 2021, there will be slight changes in the OSCE pattern where you will be getting, like, instead of 6 station, you will be getting 10 station. So there will be slight changes, like, you know, they will be adding some more skills over it. But at the moment it's going to be 6 station. So as I mentioned before, 4 is for the nursing process and 2 is for the skill station. So talking about the case of scenarios which you will be getting, like you might get patient who is having like a subdural hematoma, patient who is having like any kind of respiratory like chest infection or unstable asthma, and patient who is having like heart problems like chronic heart failure, patient who is having like pre or the post-op patient who is going for a surgery like ectopic, and patient who is having like hernia, patient who is having like depression, confusion, dementia, and all these different types of scenario which you can expect. But you will get one of this scenario on the day of your examination, but we don't know which cases you will be getting. But you need to be prepared for any kind of scenarios which you will be expecting on the day of the examination. Talking about skills, the skills which you can expect on the day of exam, but at the moment there are 8 to 10 skills. But from, yeah, as I said before, like from August 2021, there is going to be like slight changes in the skills, and they will be adding some more skills over it. But those skills are basic skills, so you don't have to be really worried about the adding of the skills. But I won't be confusing you at the moment. So there will be like mainly 8 to 10 skills at the moment, so which is basically your administration of intramuscular injection, subcutaneous injection, like giving an insulin for the patient, and either it can be like administration of inhaled medication through using a spacer, teaching a patient about using a peak flow meter, and doing an aseptic non-touch technique, which is going to be a wound dressing and in-hospital resuscitation, that is your CPR. But at the moment, because of the COVID thing, they have taken that skill out for a moment, and you will be getting some skills related to the urinary catheter, midstream urinary catheter sampling and removal of the urinary catheter and urine analysis, and then some skills related to the fluid balance monitoring and the fluid balance calculations as well. So yes, so you might get any one of those skills among those which I've mentioned earlier. So basically at the moment there are 3 centers of the OSCE, so which will be either Northampton, Oxford, or Ulster University in the Northern Ireland. So you don't have to be really worried about booking and everything, but usually hospital is the one who is going to help you with the booking. And the fees of the OSCE is mainly like, it comes in the 800 something, but some of the hospital will be sponsoring your OSCE fee, but some hospital may not, and they will give in prior and you have to like give it back to them later. But usually they're the one who is going to book you for the OSCE and everything. And And don't worry about that. As soon as you will come from, you know, your home country, and as soon as you will reach here, you don't have to worry. You will get some time to prepare yourself and get ready for your OSCE, and they will be getting you some materials for your study materials and everything, and there will be mentor who will be assessing your skills and everything. So you will get plenty of time to prepare yourself and get ready for yourself for the OSCE. So that's how it works. So don't worry, don't stress yourself for at the moment, but yes, as soon as you will reach here, you will get some time to prepare for the OSCE. So this is mainly about the OSCE exam pattern and everything. So some things which you need to remember when you will be writing the OSCE examination. I know that these all skills which we do normally in the clinical area, which we do normally, like every day, every other day, you will be talking to the patient and explaining the procedure to the patient and doing the hand washing. You do it every day now and then in the clinical area, and giving a medication, you do it every now and then. And then that's how it is. Like as soon as you come to the patient, you will try to take the history of the patient and assess the patient, take their vital signs, observations, blood pressure and everything. You do it every day. But in the OSCE, somebody is monitoring you, somebody is like, you know, it is time frame. So that's how it is really nerve-wracking and making you nervous. But try to make it as a normal scenario and try to be like remembering that you are in the clinical area. So that's how I think you will be able to try to create a natural scenario. So that's how it works. And when you practice for the OSCE, try to practice with your friends and try to point out your mistakes with others and all everything. So like if you practice in a group, that's how it really helps. And it really helped with me when we were preparing for the OSCE. We really practice in a group, so that's how it really helped us. And yes, that's how it is. So I know that OSCE is kind of like a little bit nervous, is a time frame. So make sure to focus at that time when you're writing your OSCE examination. Try to focus yourself, even though you're nervous. I know that everybody get nervous, even I do get nervous when I'm writing any kind of examination. But if you will not focus on the time of the exam, sometimes we get blackout, and then after that one you will not be able to remember what all things we need to do. Even though you do it every now and then, you know that what you need to do, but at the moment of the examination, when you get panicked and when you will be like really nervous, so that's how it will not work. So make sure to focus, and then it will be time frame. And then some things like which you do it on the OSCE examination, in every station which you do is you introduce yourself to the patient and check for the scene safety. You do it in every skills, and you do the hand washing in every skills. And do not forget to take the patient's consent. That's very important when you will be writing your examination. So those are the things which I wanted to share with you guys, like a little bit more in detail about each of the skills, and then I will share in each of the skills what all the common mistakes which we do and how that can be avoided, and what all are the tips which I can share in each of the skills. So let's begin. Starting from the assessment. Assessment is something where you will be assessing the patient and taking the patient's history and doing their vital signs, like doing the observations, like checking the blood pressure, temperature, pulse rate and everything. You will be recording everything in the news to chart, or any of the charts like which you will be providing. It may differ, some of the charts may differ, but mainly you will be getting a news to scoring sheet where you will be writing the observations like blood pressure, pulse rate, temperature and everything, oxygen saturation if there's any, like, you know. So assessment is mainly about taking the history of the patient and then knowing what's the patient's problem, so that you will be able to write in the planning station as well. Like you will be assessing the patient as well as you will be like recording the observation, you will be taking the history of the patient. So those are the things, and listen to the patient's concerns as well. So that's how you will be able to get the diagnosis out of it. So in the assessment station, the assessor will be sitting on the next to you, and then you will get a real acting patient over there. So that's how you have to literally, like, you know, talk to the patient and take the patient's consent. But in the assessment, what I've noticed that if the patient is in, like, as soon as you reach over there, if the patient is like really uncomfortable, crying in pain, having a breathing difficulty and all, you won't like do all the steps ahead. Like you just quickly do a hand washing and go towards the patient and ask the patients like, I'm the nurse who will be looking after you today and I'm going to do a quick assessment, but before that one I can see that you're having some discomfort, can I help you with it? And just make the patients more comfortable. If the patient is having like breathing difficulty, just make sure to lift his, like, you know, the head and elevation, and all those are the things which are really important for the patient. And if the patient is in pain, change the position of the patient before you do your whole assessment, then you can start with your assessment. So that's how it is. Patient is your first and most important priority when you do anything with the patient, isn't it? So that's how it is in the assessment. So you will get different types of scenario. Like if it's a neuro patient, you have to do a neurological examination, checking the pupillary response and then checking the limb power and doing the GCS of the patient and all. If the patient is like respiratory having problem, so like checking the oxygen saturations and everything. And then yeah, pre and post-op patient will be having some of the other kind of the pain, changing the position, and ensure the patient that reassurance is very important. If the patient is going for surgery, patient will be very anxious, so reassure the patient, pat them and try to comfort them. If the patient is having like any sort of like a depression patient and everything, so make sure that those kind of patients are very sensitive and try to remove any kind of hazard, like any kind of seizures or anything. If you see nearby patient, try to remove those things like which can harm the patient, you know. Those are important things. And if the patient is depression patients, like, you know, you won't be, the patient will be crying and teary, so you won't be talking and standing. You might like to sit with the patient and talk to them and give an eye contact with the patient. It's very important. So those are the things which is very important in the assessment station. So other than that, make sure to write the observation. Whatever you're writing, write it correctly so that you can take that sheet when you go to the planning station. So make sure to complete the observation because that's very important in the assessment station. So everything is time frame. Time is very important in each of the stations, so make sure to practice accordingly, practice within that time frame. Alright, so that is assessment station. And then going to the planning station, based on your assessment you will be writing 2 Nixon diagnoses. And what I've noticed that in the planning station, make sure to write it within the time frame and you practice in prior, like, you know, you will be writing like this one. So writing legibly is important. And what you need to do is that in the planning station, if you're writing a nursing intervention, write it self-care along with it so that you won't miss anything when you will be writing the planning station. But it won't be that difficult, you just have to write it, so that station will be easier. And one more thing I want to stress in the planning station is that suppose if you're getting a pre or post-op patient, read the instruction very carefully. Suppose like if they say write to post-op nursing diagnosis, so don't end up writing pre-op diagnosis, so this is not going to be counted. So make sure to read the instruction carefully when it comes to pre and post-op patient. And yeah, so this is about planning station. So in the implementation station, you will be getting to like administer oral medication. So you will be administering oral medication. So you will be getting a dummy patient where there will be like, you will get a drug chart where you have to read the drug chart, everything, and then you have to like, you know, what all things medications are due at your time, that medications you will be getting. And in the implementation station, the cupboard, medication cupboard will be locked, and then you have to open it up, and then you have to like, you know, do all the steps of all the stations like hand washing and everything, safety checks and everything. You have to do everything before in prior. But in the implementation, what we normally do, you know, like if the patient is allergic to penicillin and the drug chart has got patient have amoxicillin due, so you won't give the amoxicillin. If you give the amoxicillin, so that means that patient with the penicillin, even though it's amoxicillin, because it belongs to the same family group of medications of penicillin, so you won't be administering this. If you administer that, it is drug error. So in the implementation, make sure that if there is any kind to do with the medication administration, make sure to follow the 6 rights of medication administration. That's very important when it comes to implementation station. Very careful if the patient is having like blood pressure medications, like if the patient is having any kind of antihypertensive medication. So make sure to check the blood pressure in prior. If the blood pressure is very low, you will not administer, you will omit that, and then you will let the nurse in charge or the doctor know about it, and you need to have a rationale behind everything, whatever you do. So yes, so if you are administering medication, if you don't know the action of the medication, make sure to check in prior before you administer that, because while you give it, you have to explain to the patient, and whatever due on your time, you have to give that medication only. So yes, so those are common mistakes that we do. Like suppose like regarding the paracetamol, if the patient isn't really in pain, even though the paracetamol is not due, you can't give the medication of the paracetamol, but you can check for the alternative medication, pain relief, or you can let the patient know that I will definitely escalate this matter to the nurse in charge or the doctor, and will definitely give you some other pain relief, but not the paracetamol, which is not due. You won't be giving that medication. If you give that, you will definitely fail, because like which is not due, it's not safe to give the medication which is not due at the moment. So those are very important. Following the 6 rights of medication administration is very important. So those are the things. And after finishing everything with the medication administration, make sure to lock the cupboard, and then that's very important, because we don't want the patient to be self-administering his medications as well. So safety is very important with all the stations. So that is about implementation. Evaluation is like somewhat similar to the planning. There won't be much difference between planning and evaluation. You will be just writing the past tense of whatever you have written in the planning station. So one thing you have to remember to write it legibly, and then write it correspondingly, as I told you before regarding the nursing intervention and the self-care. Write it correspondingly so that you won't miss anything on the self-care, and you don't end up losing, like, you know, you will be going to write this exam over again. So this is one of the thing about the evaluation, and otherwise it's the same thing with the planning. So these two is like only for writing, and write it legibly. So that is very important in the writing stations. So that is the 4 stations passed, and you have a skill station. So 2 skill station you will be getting, but you have different skills, but we don't know which skills you will be expecting on the day of examination. So you need to get ready for all the skills expected on the day of the examination. Regarding the resuscitation, at the moment we don't have the resuscitation at the moment, but usually if it's there, like they have the machine, we just connect it, and they really count the depth and the rate of your compression. So that is very important in the resuscitation skill, like CPR skill, but these days we don't have it at the moment. So coming to the intramuscular and subcut medication, so this is mainly going to be like a community based. You will be going to the patient's house to administer insulin or any kind of medication in their houses. So when you go to visit in any houses, make sure to take the permission before using any kind of sink for washing their hands and everything. So make sure to take their permission prior, because like you're going at your patient's house, not in the hospital scenario. So those are the very important, and giving the health education after giving the medication, like those are very important. Anything to do with the medication administration, the correct dose, route, everything, 6 rights of medications is very important to follow them before administering any kind of medication. So when it comes to intramuscular medications, like you just have to like stretch the skin, and when it comes to the subcut medication, you just pinch the skin. So that is quite a difference between those two. And then anything to do with the skin to skin contact, you just have to clean it for 30 seconds and let it dry for 30 seconds. If it's something to do with the catheter, then you just have to clean it for 15 seconds and let it dry for 30 seconds. So that's this universal protocol for cleaning with the alcohol wipes over here in the UK. So you will follow that one whenever possible in the OSCE as well. And those regarding this medication administration. Okay, so coming to the inhaled medication administration, usually you will be giving a salbutamol inhaler so to the patient. So it's more like, you know, teaching the patient about how to use it and sitting the position and everything. It makes a difference. And even the peak flow meter and all, it's more like a talking skills, like, so you have to explain to the patient more in detail about it. But skills like ANTT, so aseptic non-touch technique, where you will be doing a wound assessment for the patient. So in that skill, most important thing is that you won't be touching everywhere after wearing the sterile gloves on you. You won't be touching. So before that one, you have to keep it everything ready and then do that cleaning and everything in a sterile manner. So that is very important. They will really check it on that station as well. So in the ANTT, you have to be very quick because you won't have much time. So that is one of the things you have to be very like, you know, you have to be organized and cleaning everything in prior, and then yeah, doing the wound assessment and everything, and cleaning in a non-touch technique, and wearing the proper PPE step by step is very important in this station. And then going to any kind of like a urinary skills, like anything to do with the urine, like removal of catheter, taking a sample from a urinary catheter and doing a urine analysis, something to do with the urine, you always have to wear an apron. So this is very important. Wearing an apron is very important in this kind of skills, because you are doing something with the bodily fluid or the contaminated fluid. So this is considered highly, you know, infectious. So if you will not wear an apron, you are not protecting yourself as well. So this is very important in this skill to remember. And then yes, moreover, in all the skills, you will follow all the steps of, like, you know, first in the safety checks, whether your scene is safe for you to go in there, whether there's any wires or anything, you will just take it away from everything, and then you will do the hand washing and everything, and then inform the patient, introduce yourself to the patient is very important in all the skills, and then you will explain to the patient, and then take the patient's consent, and then start with the procedure and everything. After finishing everything, you again wash your hands and everything. And that's how it is in all the skills which you need to remember. One more thing I want to talk about is the waste management. It's very important. Suppose if you're using any kind of sharps, so make sure that if you're giving any injection, and then make sure to dispose that right away in the sharps bin. So usually sharps bin will be like a yellow container over here, so make sure to discard it directly in the sharps bin. So that's very important, because, like, you know, it can be hazardous if, like, you're not disposing. The waste management is quite important over here. And then followed by, if you are using any kind of like clinical waste, like if you're using any kind of like a used catheter or the gauze or any kind of clinical waste, goes into the orange bin, and like a general waste goes into your white bin. So there will be only 2 bins over there when you will be doing the OSCE examination. So yeah, same thing how you do in the clinical area. So as soon as you will reach here in the UK, you will be allocated to your own hospital where you will be working. So there, when you go, you will know at least the kind of setup over here, how does it work. So same thing will be applicable in the OSCE as well. So the waste management is important. All the clinical waste in the orange bin, and the general waste, like normally after washing your hand, you wipe your tissues and everything, will be in the white bin. So this will be like general waste. Alright, so most finally, like whenever you are writing any kind of like any kind of skill, make sure that you don't if you're getting a dummy patient, if you're not getting a real patient, and if you're getting a dummy patient, make sure to look towards the patient. Don't look toward the examiner. Usually we tend to do it because, like, you know, the examiner is the one who is answering towards you as a patient, but you have to look towards your dummy patient. So that is one of the thing. And always, like, they will be recording your OSCE, so make sure to like look towards the camera whenever possible, like, you know, and be loud and audible. And the problem is that you will be next to each other when you will be doing the skill stations or any kind of like skills. You will be in different room, but you can literally hear each other, so don't get distracted and diverted because of that. I hope that everybody will be able to attempt this OSCE examination within one go, so you don't have to go back again and write this exam. So make sure when you will prepare this exam, make sure to prepare it well and give your 100% whenever you're writing. I wish everyone the best of luck who will be writing this examination, and I hope you like this, watching this video. If you really like this video, don't forget to like and put yourself in the comment section below if you have questions or anything, and don't forget to share with your friends or family who is pursuing this career. Some of you might get to learn something out of it. I'm hoping for that. And then yeah, if you haven't subscribed to my channel, please do so. And this is the end of today's video. I'll see you in the next video. Until then, take care, bye bye, stay safe.